to show you guys what it'll look like with the vacuum suction cups, because those are still really nice if you have someone who has bigger forearms, and they're still really nice because those will actually get a deeper suction. So if the patient can tolerate, which you can let me know as we're doing it, then we can get a greater muscle release. Versus these suction cups, you can get a good amount of suction, but not as much as the vacuum suction cups. So I'm gonna go ahead and grab those. We'll use the regular sized ones. We'll go where we had up at the top. So for me, maximum suction is usually 3 or 4. Too much?
No, it's okay.
You're okay?
Yeah.
Okay, so initially the first cup's always gonna be, you'll feel it more. Like it'll be a little bit more painful. I tell the patient, that's kind of normal. If you can tolerate it, then breathe, take deep breaths, breathe into
How
it.
long?
5 to 15 minutes,
Okay.
It depends. So if it's your first time, maybe more towards 5 minutes and see how you feel. Again, I'll check in along the way, like how are you doing? If it feels okay, then I'll keep it on a little bit longer. If I see that it's at a good spot and we're getting a good amount of redness there. If it has good blood flow, if it's light red, good blood flow, then usually 5 minutes and I'll move on to another spot where it might have more stagnated blood and be more beneficial for this. Yeah.
What do you think about pairing this with dry needling?
I don't like to pair both of them because you get really sore with dry needling and you get really sore with cupping. So it's just too much for the patient, where I think it's too much for the body. So I like to pick one, and then the next time around, if they want to do the other modality, we can do that. Usually with the forearm, I like to start with cupping because I can get a really broad area. Like I was able to get the whole forearm in less than 10 minutes. And then after we're more broad, then next time I'll do a little bit more dry needling because then I can get more specific to the muscles. Yeah, good question. So from here, sometimes I can move it around. If I move too much, I can see it'll probably start losing its suction there, just because the angle's a little bit harder. But if you use some of the smaller cups in the set, they don't suction well. So they're really good. The size is nice for the forearm, but you'll find, you okay? You'll find that over time, it'll start to lose suction and then it'll kind of pop off. So you can kind of use it and get whatever amount of time that it does stay on. But I like the silicone ones a lot better because they're a little bit more flexible, so they can stay on there a lot longer and go around the bony parts with a good amount of suction. Yeah, so from here, I like to go do a little bit of stretching, hold it, and go side to side. And it's very little motion for me, but for the patient, they'll feel it a good bit, especially if they're having pain. So no need to like force it really, just a little bit gentle. The slower the better, because then it'll be more relaxing for you. Yeah, so we'll go ahead and take those off. This one was not too bad, it actually stayed on pretty well. People say the release is the best part. Let me go ahead and take a little bit of that pinwheel off.
How long do the marks stay on?
So for yours, it's a little bit more light red. Within a couple days, maybe 1-2 days, it'll start to fade away pretty quickly. They're just small petechia responses there. For people who have darker marks, then they'll stay around for maybe sometimes a week. Yeah, how's it feel?
Feels good.
Yeah, does it feel looser at all?
Yeah, and I think it's less tenderness too.
Yeah, nice. You can go golfing later without pain. So that's how I do a quick session for cupping using massage cups, sometimes vacuum suction cups, getting in a little bit of that dynamic cupping to help with any type of elbow pain, wrist pain, anyone that has pain with gripping and turning doorknobs, anything like that. This is really beneficial for. And even if they can only tolerate a little bit, like 5 minutes, you'll tend to notice a difference after that. So one of my favorite modalities to use. If you liked this video and found it helpful, go ahead and like and subscribe, and then feel free to leave any comments down below if you have any questions about the process of cupping the elbow.